Is surgery in the near future for you? If so, then you might have been instructed to get a pre-operative physical. This is a crucial part of your surgical experience and shouldn't be taken lightly. But what is a pre-op physical exactly, and why is your surgeon telling you to get one? Furthermore, what happens if it doesn't go well? This video will answer these questions and more. A pre-op exam assesses your overall health prior to undergoing a surgical procedure to determine if there are any potential risks for complications that need to be addressed in advance. It also helps determine if you'll need any special care during or after your surgery. Typically, a healthcare provider other than your surgeon will conduct it. While these exams vary based on the surgery you're looking to obtain, factoring in age and gender, the more common tests include lab work, an EKG, a chest x ray, and a general physical. In particular, the surgeon wants to make sure that your heart and lungs are healthy enough to withstand the stress of anesthesia and surgery, and that you'll be able to get through your post operative care. You can expect the exam to consist of three main parts: collecting your medical and familial history, a physical, and any requested lab work and diagnostic testing. Your provider will want to know about any other surgeries you've had in the past, medications you're taking, and related complications that your relatives might be dealing with. They'll also ask about any smoking, drinking, or recreational drug use. The goal is to uncover any potential problems that could arise during or after your surgery. If your surgery is planned, and especially if it's elective, then getting medical clearance via a pre-op exam will most likely be required. If it's an emergency surgery or a procedure that's scheduled less than 24 hours in advance, the exam might not be required. In a perfect world, you get your pre-operative physical and everything checks out. But what if it doesn't? Well, depending on what underlying health issues the exam uncovers, you might be instructed to receive follow-up care. For instance, if your provider detects a heart murmur, they may send you to a cardiologist. If you learn that you're more prone to blood clots, then you might need to visit a hematologist. This doesn't mean that your surgery is going to be canceled completely, although it might be delayed. However, even if your provider uncovers health issues, it might not disrupt your surgery at all. It just gives the surgeon the information they need in order to perform your procedure safely and effectively. This is why it is important to schedule your exam as soon as your surgeon requests it. While it's true that you could find another surgeon who's willing to take the risk and perform surgery on you anyway, if your current surgeon pauses your procedure due to the results of your pre-op exam, the wisest choice is to address those issues, plain and simple. Remember, you're doing this to ensure that your surgery and recovery go as smoothly and safely as possible. It doesn't pay to cut corners. So, does a pre-op exam guarantee that surgery will go well? Unfortunately, no. Even the most thorough and detailed pre-op exam can't guarantee that there won't be complications with your surgery. When it comes to surgical procedures, there's always some inherent risk involved, even for the healthiest patients, like heavy bleeding and infection. However, with a proper pre-operative exam, your healthcare provider will greatly reduce the likelihood of anything going wrong once you're under the knife. Also note that thankfully, severe complications tend to be rare. The time leading up to a surgery can be stressful, overwhelming, and confusing. We're here to make the whole process smoother. At E7 Health, we can provide all of the necessary services as outlined by your surgeon. Our board-certified physicians and clinicians will review your complete medical history and perform a physical to ensure that you're fit for surgery. If you require any additional lab work or diagnostic tests, we can perform those in the same visit and usually deliver your results within 2 to 3 business days. Other pre-operative services that we offer include chest x-rays, EKGs, urinalysis, screening mammogram, nasopharyngeal COVID-19 test, complete blood cell count with differential, comprehensive metabolic panel, hepatitis B antigen, hepatitis C antibody, urine or serum HCG for females, PTT, PTINR, and HIV. Before scheduling your appointment with us, be sure to check with your surgeon to determine what specific tests you need in order to be assessed for surgery and the date by which you need to turn the results in. Surgeons typically require the results 2 to 4 weeks before your surgery. We make things as convenient as possible and can usually offer same and next day appointments at our 2 Las Vegas locations, so you'll get everything you need prior to your surgery without delay. We know that your pre op exam is a crucial step in the process, and E7 Health is here to make it move as quickly and smoothly as possible. Surgical procedures and the medications used during them can place your body under extreme stress, and recovery can take weeks or even months. Don't underestimate the important step in protecting your health. You don't have to do it alone. We're here to help. Book your appointment online today.